Hello, it's noon on Friday, and that means it is time for our Facebook Live, our Lunch and Learn, and we're trying to get a sound check to see if people are being able to hear me, because that's an issue that we have here in the greater downtown Humble internet. So we're going to talk today about mold. We're going to talk about respiratory issues. And we're also maybe going to talk about some things that are in the news regarding immunizations. So I know we've done immunizations before, immunization ingredients and that kind of thing, but it is in the news. So I just want to touch base with that just quickly. Hey, good to see you, Daniel. We're praying for you. Anyway, in the news, there's this judge that is ordering this mom to vaccinate her child, and she doesn't want to. And social media is a little bit disingenuous with this story, so just want to keep you up to date on that. They're not making her vaccinate her child. What they're doing is they're making her adhere to the custody agreement that she and the baby's father have. So they decided that they were going to do one thing. They went before a judge. It was all signed, sealed, and delivered. And at the end of the day, she changed her mind. So the judge is saying, no, can't change your mind. You got to stick with the agreement. So this is not necessarily an anti-vax, although it is, but there's more to the story. So just so you know that, if you don't want to vax, we certainly applaud that. We think that's just the wisest thing to do. But you've got to fill out the appropriate paperwork, and then you'll be able to be protected. So don't get all skewed up with the social media hyper links there, because they're not being quite as honest as maybe they should be. So if you live in our area, which is really any of the Gulf states here in the United States, certainly South Texas was inundated with Hurricane Harvey, and Florida was inundated with Hurricane Irma, and I'm sure that the other Gulf states are as well, Louisiana, Mississippi. I'm not sure about my geography, so I'm going to just stop right there, but you know who you are. And then if you're in the Caribbean also, if you're an island nation, and we know that you've been affected. We know that Puerto Rico is very, very affected. So we send our prayers to you. But this is what we want to talk about today. We want to talk about the rise in respiratory issues. So if you have respiratory issues, or you have family members or friends that have respiratory issues, we want to just do a little bit of current events here, and I can help you with this. Okay, so this is in our area. This was actually, I think it was on the local news last night. And so we've got these entities reporting in: Memorial Hermann Medical Group, in all the different areas, not just in the Humble Kingwood area, but all over the city, right? So what these doctors are saying is that they're seeing higher than normal rates of respiratory infections, including acute bronchitis and sinus infections that are lingering longer than usual. They go on to say that normally it's because of the ragweed, and we all know that ragweed is quite a potent allergen, and so we want to be protected for that. But the doctors are saying, this is at the clinic in Imperial Oaks, which is in North Houston, kind of in the Spring area. I'm seeing more sinusitis, bronchitis, exacerbation of asthma, along with headaches, with many of my patients saying they helped clean houses after the flooding. So this is important. Now, I know a lot of us have gone out and helped people, helped our family, helped our friends, helped our community, and I applaud you for that. But what you need to understand is you need to protect yourself. You're in a very, very high risk environment for this mold. Now, the statistics say that if you have something that's wet, and it's been wet for longer than 2 days, it already is growing mold. So we know that we had about 4 or 5 days of incessant rain, and if you were flooded at all, by the time the waters had receded, it was a couple of days. And so, you've got mold. You've got it in your home. You've got it in your yard. It's in the street. It's everywhere, and mold is a spore. Spores are released by the wind, they're released by the breeze, and they're going to be wafting around in our area wherever you are. So even if your street didn't flood, even if you particularly have not helped somebody and you've not been in that environment, you are still susceptible because it is in the air. I was going to go and sit outside one day this week after work. It wasn't hot, there was very little humidity, there was a breeze, and it was like, oh, I just think I want to go sit outside and read a little bit. It's been a hard day, I've been inside all day, and it really does me some good to go outside. But I was very concerned about mold exposure. I had gone out a couple of weeks ago and on a Saturday, and I had sat outside to read a book and just relax and enjoy the weekend. And when I went back in that evening, I had some scratchiness in my throat. And so I know that it is the mold exposure and that kind of thing. So fortunately, I know what to do, and by the next day, everything was back under control. But I want to share that with you. So if you do choose to get exposed, then you don't have to rush to the doctor with all of these kind of ailments, okay? So be careful about being outside. Be careful with your children about being outside, okay? I want the little ones to be outside. I know they need to play. I know a lot of things need to happen and get all that energy out. But what you want to do is you want to take precautions. Now, there's something that you can do, moms with young ones, the little ones, in fact, all of us really, but the little ones who are going to go outside, and you know they're going to play in the dirt, and you know they're going to put their hands in their mouths, and you know they're going to wipe their nose, and you know they're just going to spread the ick around, right? So this is what we used to do when the babies were tiny and they were home, and they would be fine, no respiratory issues, but then when they would go to church nursery or they would go to Mother's Day out or whatever, what would happen is that they would get some kind of respiratory infection. And so what we decided to do is get a little sprayer, a little nasal pump sprayer, and we would put liquid silver with nanotechnology in that little sprayer. And before the babies would go into nursery or Mother's Day out or wherever they were going to go, we would do 2 pumps up each nostril. When they came home, we would do 2 pumps up each nostril. And that really, really alleviated any kind of respiratory distress. So that's something that you can do with them before they go out to play. It's absolutely non-toxic, and it won't hurt them one little bit. It's antibacterial, it's antimicrobial. I'm pretty sure it's antifungal, but don't quote me on that one. But it's really, really good protection for that. So you don't want to be confused with liquid silver with nanotechnology or colloidal silver, right? Nanotechnology is what we recommend because colloidal silver is a particulate, and the silver will fall out of the solution, and so you have to be careful. And I'm sure you've read stories on the internet that show that when you use silver too much, you can turn blue. Well, we don't want you to join the Blue Man Group. So if you use the silver with the nanotechnology, you will not turn blue, and it's very, very safe. It's very inexpensive. The brand that we have has 20 parts per million, which is one of the highest silver concentrations that you can buy. So this is something that you can do with your babies if your babies insist on going out. And of course, we want them to get that energy expended, and it makes for a happier mom and that kind of thing. So we want you to be able to use that spray. Yes, Daniel, that spray would be very, very good for you because you're exposed. Any of the construction workers, any of the mold remediation specialists, anybody that's helping people, you need to do this. It's very, very easy, and we definitely can help you with that. Your nasal passages are moist, dry areas. This is what is conducive for mold spores to sprout. We don't want that to happen. So if we can use this, then it will help you. Now, Daniel, I'm hoping that you also wear a mask. It would probably be good if you had a hazmat suit, but I'm not sure that that's something that we can get for you, but if you wear a mask, you're going to be eliminating what can go into the nasal cavities and down your throat, but also the silver with nanotechnology would be something that I would highly recommend for you. So we want to make sure that that happens. If you're out riding a bike, wear a mask. If you're out, if you go into the car, to the grocery store, I don't think that that's a huge thing. But if you're outside for any extended period, then you want to take care and protect yourself. So I'm going to go on with a little bit more of the news here. This other doctor says, in addition, many of his patients are struggling with chest colds, hacking coughs, and they said they've helped muck out and gutted flooded homes in the immediate aftermath of Harvey. Now, we did that too. Steve was out in the water, and we were in these areas of high risk, and it wasn't very long, like maybe 12 hours, and he started getting this hacking cough. And so we treated it with essential oils and castor oil packs and mustard plasters and all that kind of stuff. We're going to actually be talking about that on our essential oil class on Tuesday, this Tuesday night at 6:30 here at the clinic. Now, I'm excited but a little nervous to say that this event has been shared multiple times by people I don't even know. So I don't know how many people are preparing to come. We ask that you RSVP so we have enough chairs. Our space is limited. We do, have some classroom space in the clinic, but it's not huge. And so if you're planning to come to that, then we're going to share some secrets with mold and that kind of thing. But I need you to call in and tell my ladies that you're planning on coming so that we can support you appropriately. So that's just something that we're going to be working with. But suffice it to say that just being out in the community for a short amount of time can really wreak havoc with your respiratory system. So we want to make sure that that is taken care of. The Herman Memorial Group in the southwest side of town says that they are seeing people that have been ripping out drywall and insulation without wearing masks, and they've got this respiratory issue. So Katy, even in the Katy area, they're saying that they've seen a rash of acute bronchitis since Harvey inundated the area, urging patients to take extra caution to avoid mold exposure, especially if they're already experiencing symptoms of upper respiratory infections, okay? It's a good idea to avoid anything that looks and smells like mold. If you don't need to clean it, if you do need to clean it, make sure you wear the appropriate mask designed to specifically protect you against mold. And Linda, thank you for joining. It hasn't come up on my screen, but it came up on Trish's, so thank you for joining there. Some acute bronchitis is viral. If you get the viral type of bronchitis, then the liquid silver will help with that too. Now, one thing I want to tell you too is that if you get these fungal infections, we've got a high incidence of having superbugs. Now, a superbug is a pathogen, either a bacteria, a fungus, a whatever, right, that has seen antibiotics and has mutated so that it is antibiotic resistant. So this is what we're finding, and there's been some news about it. I've blogged about it. I have done the radio program about it. We may even have Facebook Live about it, but I just want to bring this in. There is a superbug called Candida auris, A-U-R-I-S. It has been identified in the most recent years, and it is a superbug that poses a catastrophic threat to the public. Now, anytime somebody's saying something is a catastrophic threat, we need to really, really pay attention. So if you are my patient, if you do come into the clinic and I know you and I take care of you, and you get this kind of bronchial thing, then we can do a remedy for you that takes your DNA and it actually tailor makes the remedies for you. Now, what is the benefit of this? The benefit of this is that the bug, whatever you have, has never seen this remedy before, because I am making it out of your DNA so that it is absolutely brand new and there's no resistance to this. So we've got this very, very high powered weaponry. I'm going to call it weaponry, biologic weaponry, but it's in the right kind of way. We're not killing you, we're killing the germ, and it'll go a long way if you happen to have those kind of pathogens. So that's something that we can look at. This particular candida was identified 8 years ago in Japan, okay, and so it's been on the rise. It can take root in the bloodstream and in the urinary tract. So I know we were talking about Heil-Mealey. I know we were talking about in the respiratory, but also it can come at any other, in other body functions as well. So if you have chronic UTIs, if you have chronic kidney disease, that kind of thing, we might be looking at that kind of a fungal pattern. So it is a high fatality rate. I hate to tell you that because that's kind of a downer, but if you have this particular fungus, it's about 60% fatal. So we don't want to have that. We don't want you to have that. So we can eradicate this, right? Mm-hmm. It says that eradication in hospitals is very difficult because in some cases, and in some cases has led to the closing of the hospital wards. So this is something we don't want to mess around. So this is why it's very, very important that if you get any kind of respiratory issue, we take care of it, and we take care of it properly so that you don't wind up in that group, okay? So giving you information, not trying to be a fearmonger, not trying to say, oh my goodness, if you don't do this, blah, blah, blah. Not trying to do that. What I'm trying to do is just give you information, okay? So hopefully that helps. I've got some time for questions. If anybody wants to ask a question, it doesn't appear that my news feed is scrolling. And my staff is busy with in-house clients. We are a working clinic, and the lobby is open, and we have people in. So if you're asking a question, it's not scrolling on my screen, and I don't know why sometimes it does that and sometimes it doesn't. It makes me frustrated, but there you go. That's what you have. Going back to our vaccine issue, also in the news, and I don't know if I brought that paper out. Let me just see if I brought that paper out. Maybe did it. All over the news and everywhere you go, people are asking you to get the flu shot. So let's just get some things out there. In the World Health Organization, okay, the WHO, they say that the flu shot is absolutely ineffective on anybody 65 or older. So if you're 65 or older, then you don't need to be getting the flu shot because it's absolutely ineffective. If you're younger, right, if you're younger, then these are some of the ingredients that we have in the flu shot. You've got formaldehyde, which you don't even want to have formaldehyde, right? Polysorbate 80, and thimerosal, all right? The thimerosal is a mercury derivative. Mercury is a neurotoxin, okay? Neurotoxin. Daniel, I know you don't like that spraying stuff up your nose. I get that. We've got some pills that are antifungal, and we can start you on a preventative case of that if you want to do that. We can do that. It's not going to be as effective. I'm just warning you. So make sure that you are able to wear a mask as much as possible, okay? So back to, and thank you for that question. I appreciate that. So back to thimerosal. Thimerosal is a mercury derivative, and it is a neurotoxin. It crosses the blood-brain barrier. Now, for little children, right? Oh, we're going to get bumped in a minute here. We've got somebody in the clinic who needs something just right here. What are we looking for?
15 milligram capsules.
Yeah, we're trying to help people in the clinic. Sorry about that. With our children, right, our little babies, the vaccines, I know they've been invited to get flu vaccines too. Everybody over 6 months are invited to get the flu vaccine, and I'm just saying I'm going to pass by that opportunity. I do not want it, and I certainly don't want it in my little babies. It sets up that encephalitic scream that you have, and you set up all those other things. And so we don't really want to have that in there. And there are other things that you can do holistically to prevent you from getting the flu. Let me be extremely clear. If you get the flu shot, you still are able to get the flu. The flu shot does not prevent the flu. The flu shot tells your body, or tells your immune system, or helps your immune system to get rid of the flu 24 hours earlier than someone who did not get the flu shot. So you have to weigh up the benefits and risks of, do you want to have the thimerosal that crosses the blood-brain barrier, or do you want to protect yourself? So even little babies, if we keep their immune system strong, they're not going to die from the flu. Most people do not die from the flu. Let me just go over what the side effects are for the flu shot, right? Tenderness, fever, fatigue, headache, trouble breathing, wheezing, swelling of the eyes and lips, hives, weakness, fast heartbeat, and dizziness. Well, that kind of sounds like the flu to me. So I do what you want to do, but I'm just giving you that information. Daniel asked, what is the protocol for flesh-eating bacteria? What are the signs that you may have it? Okay, Daniel, that's a really good question. The signs that you have it, if you have signs that you have it, it's almost too late. You want to get yourself to the hospital as quick as you can. In the flood waters here in the Houston area, and in the Humble-Kingwood area, and in the Orange Viter area, there are scientific studies that show that there is flesh-eating bacteria in the water. There is also E. coli in the water. And so if you are cleaning out, mucking out, all that kind of stuff, and you cut yourself or you have an open wound and you get the flood water in that, then you are going to be susceptible to the flesh-eating bacteria. So the protocols are unique and individual as each person. So what you want to be doing, if you have an open wound that you did get flood water in, you want to look at that wound. If that wound is not healing, then you need to get to the doctor and tell the doctor, I have been exposed to the flood waters. I have this cut. It's not healing. They can do whatever they test that they do, and they can tell if it is flesh eating or if it's not. If it's just a regular infection, then your life is not going to be in danger. You may have spent a little bit of money to go to the ER, but it's well worth it when your life is at stake. If it is the flesh-eating bacteria, what they're going to do is they're going to stick you in intensive care, pump you full of antibiotics and different things like that, which they're going to need to do in order to save your life and hopefully save your limb. I don't know if it's public knowledge about the lady in Kingwood. There was a lady in Kingwood that was flooding, and she fell or nicked herself somehow in the water. And she didn't last too many days, maybe a week, 4 days, 5 days. 5 days. 5 days after she went in the hospital. It's fast moving. It is a nasty, nasty thing. So make sure you're protected. And this is why, now as a kid, I'll just tell you, we lived on the San Jacinto River, and we got flooded. And especially anytime Conroe Dam would open, we would get flooded. And we didn't know any better. And we would go out and we'd play in the ditch, and we'd do this and we'd do that. And we didn't have waiters. And I mean, thank God we lived to tell the story. It's just the way it was. But here we are. We know better. The environment, that was, 50 years ago when I was doing all that. And so it's just a case of now the world is so much more toxic. There's so many more chemicals. Our immune system is so stressed that, we just have these issues. Okay, I'll tell them. And so anyway, so those are just the kind of things we don't want. We don't want to have any kind of issue with flesh-eating bacteria. So be good to yourself. Be hyper vigilant. Now, I think I just have about 5 minutes, and I want to share some exciting news with you. If you go to our webpage, and it is www.pollyheil-mealey.com. Yes, that's my name. If you'll go there, or just Google Dr. Polly, and it'll pull up the webpage. And what you will see is our brand new redesigned webpage. It's fully interactive. It's mobile compatible, and you can call us from your phone now. We're just much more interactive. So it's a new look, and I hope you will look at it. Tell me what you think. Use that call button if you need to. And all of our social media is connected there, as well as our YouTube. So, did you get what you need? Mm-hmm. Okay. As I said, we've got, we'll show you. It'll be backwards. Ta-da! What do you think? Let me know. That's me. I don't know if I can do this upside down. Let me see. Let me see what there we go. We got new colors. We have new tabs. So it's very, very interactive. And the thing that I like about it is, let me just see. Well, I don't know where it is. Maybe on our home page. Yes, on our home page, right? We've got our products. There's a little click that you can click on. Quality of products here. If you do the read more. I don't even know if you're seeing all this. Read more. Ta-da! You can go right to the page where you can order your essential oils. You can order your Genesis Pure. You can order, I don't know, all the things that we have that you can order online without coming into the clinic. So, new website, all new, professionally designed, and all that, and a bag of chips. So, I hope you will enjoy it. Let me know what you think. We've worked how long have we been doing this? 2 months, 3 months?
Something like that.
It's been a long time. So, it's almost like giving birth. We're so excited today. So, I want you guys to be good to yourself. If you have any questions about mold, if you have any questions about anything, you know where we are. And I want you to have a great weekend and go to church on Sunday, kneel for the cross, stand for the flag.